I'm Mason. I'm your nurse practitioner today. Are you Mrs. Harris?
Yes.
So just to verify, I'd like to ask you a few questions. How old are you?
27.
Okay. How would you like to be addressed gender-wise?
Female.
Okay. So, what are you here for today?
I have been having these headaches that just won't go away.
Okay. Any other concerns that we can cover today?
Not really. That's
Okay.
my main one.
Okay. So when did these headaches start?
They've been happening for about a month.
Okay. What were you doing when this started?
I notice them mostly when I am at work.
Okay. And then how often are you at work?
3 days a week, 12-hour shifts. I'm a nurse and I work night shift.
Night shift nurse.
Mhm.
Okay. So how long are they lasting at work for you?
About throughout the shift, I usually have to take some ibuprofen to make them go away.
Okay.
Or at least make them tolerable.
Okay, so that does help or not really?
A little bit.
Okay. Anything else that is relieving for those headaches?
Mm-mm.
Is there anything that really makes it worse?
When I'm really busy, running around, that kind of stuff, I notice it getting worse.
Okay. So not so much when you're kind of downtime, a little bit of it.
Mm-mm.
Okay. What kind of pain? Like, can you describe it?
It's just like a throbbing headache, basically.
Where you kind of were pointing to the front.
Yeah, but it's not really in a particular spot, just kind of a general headache.
General, okay, all over headache. What would you say the pain is on a scale of 1 to 10? 10's the worst pain.
I say at times it can get up to an 8, but sometimes with the ibuprofen, it's around a 5.
Okay. So, has it affected your workflow at all?
For sure. I can't really take care of my patients sometimes because I'm hurting and I have to go take medicine and somebody has to cover my patients. So it's not really ideal for the job that I have to do.
Okay. So you mentioned that you do take ibuprofen for these
Mhm.
headaches. What other medications are you on?
I take a daily vitamin.
Okay.
I take a calcium, Oscal, and fish oil. I take 2 of those a day. I'm on my birth control, it's NuvaRing, and I am on high blood pressure medicine.
Okay.
already.
I have down here that you are on hydrochlorothiazide. Is
Yes.
that still correct?
Yep. That's
Okay.
it.
What about, do you have any allergies?
No.
Okay. Nothing environmental, medication-wise?
Nope.
Okay. What about any alcohol use?
Just socially.
Okay. What is your socially? Like, how often per week or month or
Once a month.
once a month? Okay. And what do you usually drink?
The seltzers.
Seltzers. Okay. And how many do you drink at a time?
Probably like 5 or 6.
Okay. Any drug use with that?
No.
What about any tobacco, chewless, or smoking?
Nope.
No. Okay. Overall, other than having these problems with your headaches, how would you describe your health?
Pretty good. I think I'm a fairly healthy person.
Okay. So medical history-wise, we'll get into that just a little bit. As a child, did you have anything like measles, mumps, scarlet fever, chicken pox?
Chicken pox.
Okay. Any others that you would have? Okay. And your medical history, any sort of disease process that you have going on. So you're on hydrochlorothiazide.
Yeah. And
And-
high blood pressure.
Okay, so you have high blood pressure.
I do have kind of high cholesterol, which is why I take the fish oil.
Okay,
And my triglycerides a little bit.
okay. And when were the last time those checked?
Last summer.
Last summer. Okay, about a year ago. Do you remember if they were kind of good or not, or were they improving?
My triglycerides improved, but I don't think my cholesterol did.
Okay. We'll have that in your chart just to kind of go over that. Do you have any other medical problems like diabetes, asthma?
Mm-mm.
No, nothing.
Nope.
Okay. What about past surgeries? Any even minor surgeries?
Nope.
Tonsils taken out? Okay. So for you said you were on birth control.
Yes.
So your NuvaRing.
Mm-hmm.
How regular are your menstrual cycles?
Regular.
Regular.
Mhm.
Okay. Any like major symptoms with that?
Nope.
Okay. Do you have any children now?
Mm-mm.
Okay. And are you seeing someone? Are you married?
Married.
Married. Okay. Male or female?
My husband.
Yes.
Male.
Okay. So, a little bit more about history-wise. Have you ever had to go to a counselor or a therapist?
No.
Any medications you've ever had to take for mental, like anxiety, depression? Okay. And what about your immunization? So, as a kid, were you immunized?
Yes.
Okay. And now we kind of have seasonal stuff. So, did you have your flu shot this year?
Yes.
And the big thing now is COVID.
Mm-hmm.
Are you vaccinated, not vaccinated?
I've had both my vaccinations.
Okay, all right. So then you told me that you had your labs drawn last year. Okay, was that with? Did you just go for labs? Are you?
I had a physical too.
Okay, all right, yearly physical.
Mm-hmm.
What about? Do you get your vision screened?
Yes.
Yearly.
Every year.
Okay.
Yep.
And what about dental?
Every 6 months.
Okay, perfect. Have you ever really had your hearing checked?
No.
No. Okay. Any issues with hearing?
Nope.
Okay. All right. So family history. We'll kind of go over some of that stuff. Do any of your like mother, father, grandparents, aunts, uncles have any major medical history?
Well, my high cholesterol, my mom's side of the family, so my mom and her mom have the high cholesterol,
Okay.
and potentially the high blood pressure too, I think. And then my dad's mom has a history of like blood clots, DVTs, and PEs.
Okay.
So,
That's your dad's mom.
yes.
Okay.
And that's basically all I kind of know.
Okay. Perfect. No. Remember any cancer or anything like that? Okay. That's great. So. A little bit more about you. How do you describe your strengths in life?
Well, I mean, I guess I'm a pretty punctual person.
That's
I like
good.
to be on time.
Good in nursing. That's great.
Yes.
Okay. What are your interests outside of working?
Well, outside of work, I kind of just like to chill at home, watch some Netflix.
Okay.
I like to do some crafting.
Okay.
That's mainly it.
Good. Would you say that that's helpful, kind of with your busy day, stress
Yes.
at work?
Yep.
Good. What about when you come home from a really busy day at work? How do you cope with that?
Sometimes I have to vent to my coworkers,
Okay.
but kind of taking a shower, relaxing, getting in bed, watching some TV, and then going to sleep.
Okay, perfect. So you have people there for you.
Yes.
Okay.
Absolutely.
Awesome. What do you feel like are fears maybe in life?
I don't necessarily know
Okay.
about fears.
It's kind of hard to think about that. It's not something you want to think about.
Right. Yeah.
So then we already talked about you work as a registered nurse.
Mm-hmm.
Okay, that's great. So what was your last year of schooling?
It was my bachelor's degree,
Okay.
and I graduated in 2017.
2017.
With that.
Good. Okay. So you said you're married.
Mm-hmm.
Okay, live at home with husband.
Yep.
And how do you feel safe at home?
Yes.
How is the relationship between you guys?
Very well.
Very well.
Yes.
Okay. Good. Do you feel like when you come home with that, it's more of a stress reliever? Do you think that that's something that you have any extra stress when you come home?
Not normally.
Okay, good. So we kind of talked about a little bit of recent stress with your job being
Mhm.
really kind of busy. That's when you notice the headaches
Yes.
and everything. What about long-term stress? Has there been things that have been in the past that are kind of there, stressful wise?
Not really, but I feel like long term I'm always going to have work, so that's probably always going to be a stressor in my life. Even though I love my job, but it is stressful.
Right.
So
Okay. Yes, unfortunately, jobs
Yeah.
can be sometimes. Do you have any like religious preferences or
Christian.
Christian. Okay.
Yep.
Is there any religious practices that might conflict with your medical care?
No.
What about, I know you talked about when you come home, stress reliever, you do crafts and things. What about any type of lifestyle habits that you feel like you've accumulated?
As in good or bad?
Let's do good first.
Well, I guess not necessarily, other than the things that I mentioned.
Okay. So
Sometimes exercise will kind of help me decompress a little bit.
Great. So how often would you exercise?
I try about 4 times a week.
Good. That's great. And what exercise do you do?
Usually just cardio, running on the treadmill, doing the bicycle, that kind of
Great.
stuff. Once in a while, I'll do some like weightlifting, but
Okay.
not very often.
Okay, that's good. What about your diet? How do you? What
Could
are your
be
habits?
improved, but we mainly eat at home majority of the week. We might go out once, maybe twice, eat out,
Okay.
but we try to have semi-decently healthy meals.
Good. Okay, that's great. Home cooked meals. What about any caffeine intake?
I do drink coffee, night shift nurse, so I usually drink 1, maybe 2 cups of coffee.
Okay.
Days at work and even on my days off.
Okay.
But that's mainly it.
Do you notice when you drink coffee at work, does it affect your headaches at all?
Not really.
No. Okay.
Mm-mm.
Any other type of caffeine other than coffee?
Tea, very rarely,
Okay.
but I don't drink soda.
Okay. So overall, like kind of your safety habits, like seatbelt wearing in the car, texting and driving.
Yes.
Are
I
you?
try not to have my phone out, but seatbelts are a very big thing for me, so absolutely.
Good. Okay. So kind of to go over whole like body systems, a lot of questions, and if I go over any that you might have, stop me. So have you had any weight changes, fever, fatigue, any extra weakness?
Nope.
Okay. So your skin, have you had any like rashes, lumps anywhere that you know of, itchiness?
Not that I've noticed.
Okay. What about, have you noticed any changes like in your nails or in your hair?
No.
Okay. So what about, have you had any like lightheadedness, dizziness, any sensitivity to light? Okay. What about any double vision, earaches?
Nope.
Okay. Any problems like sore throat wise? Any trouble swallowing? Okay. I know you mentioned you didn't really have any major problems with menstrual cycle, but any like breast tenderness, discomfort?
No.
Okay. What about, have you had any coughing, shortness of breath?
Nope.
No? Okay. Any like pain with breathing, like even when you're exercising? Okay. What about your heart? Any feelings of like it fluttering or kind of skipping a beat?
Nope.
What about any chest pain?
Mm-mm.
Okay. So when you go to sleep at night, do you ever have to use any extra pillows to kind of raise your head up or
No.
anything? Okay.
Mm-mm.
What about bowel movements? Do you have regular bowel
Regular,
movements?
daily.
Okay. Daily. Perfect. Any like nausea, vomiting?
Mm-mm.
Okay. Do you notice any like bloody or black stools?
No.
Okay. Do you notice any like swelling in your legs or pain when you're walking with
No.
them? Okay. Any extra, like do you feel like you're urinating a lot? Pain with it, burning, anything like that?
Nope.
So I know you work out, but other than the normal soreness, do you notice any like joint stiffness, muscle stiffness?
No.
Okay. Any swelling or back pain?
Mm-mm.
Okay. Do you notice you have like extra like nervousness, anxiety that you notice You're not dealing with very
Mm-mm.
well. Okay. What about any suicidal thoughts?
No.
Okay. Do you notice if you have any like major changes in mood, or any fainting spells, or vertigo?
Nope.
Okay. When you got your blood drawn, do you know if your blood levels were low at all? Do you remember?
I think everything came back fairly normal besides
Okay.
the cholesterol and triglycerides.
Okay,
so.
perfect. Do you notice that you bruise easily at all?
Mm-mm.
Okay. Do you notice, do you ever have problems with extra heat or cold?
No.
No, none of that. Okay. So that kind of goes over all your medical history. Is there anything else that you can think of you might be having problems with?
I don't think so.
Okay, perfect. Thank you.
Mm-hmm.